TSL Nigeria TV, where we have news on politics, sports, entertainment, and so much more. Did you know that we also have feature stories where we talk about nothing but everything? It's the Breakfast Show on TSL Nigeria TV.
Welcome to the Breakfast Show on TSL Nigeria TV. My name is Joyce Jupiter and it's the weekend! Yay! How do you guys feel? Good morning.
Good morning.
I missed you yesterday, first of all.
I know.
I missed you.
Say thank you first. Before you do, I know.
Thank you. I saw the coolest thing on my phone this morning. First of all, I just want to say, everyone out there putting out endgame spoilers, let me not say it's going to spoil your life. Put out spoilers. And speaking of Endgame, there's a really cool Google ad right now. If you go on Google and search for Thanos, and when the search comes up, there's a gauntlet by the side. You click on the gauntlet, the finger snaps, and half of the searches begin to disappear.
Right? That effect is crazy.
It's too cool. It's too cool. How was your night, Juliet?
It was beautiful.
And Neki?
Mine was eventful.
Eventful. So while men slept,
I was
sleeping events.
No, I was sleeping at intervals.
I'm just going to move right into the newspaper review for this morning. I have with me the Vanguard for Friday, April 26, 2019. April has just been April for a while now.
4 days to go.
2019. Now, the major story is why police misuse arms, kill on duty, said by the IGP. You can find the story on pages 8 and 9. Stop 12-hour 2-shift work structure in police. Direct reversal to traditional 8-hour 3-shift standard. Poor supervision, wickedness responsible for killings. Stress is a factor, doctors. Nigeria at war, Shehu Sani. Senate summons IGP Adamu to appear at plenary next week. All of these stories, you can find them on page 8 and page 9. I also have two picture stories. The first one on the left, Access Bank's 30th AGM. From left, Group Deputy Managing Director, Access Bank PLC, Roosevelt Obonna. Group Managing Director, Herbert Wigwe. Acting Chairman, Ajo Rishijere Awashika. And Company Secretary, Sunday Kochi. During the bank's 30th Annual General Meeting in Lagos yesterday, provided by Akim Salau. And on the right, I have Sterling Bank's 57th AGM. From left, Dr. Omolara Akanji. Non-Executive Director, Mr. Abubakar Suleiman. Chief Executive Officer, Mr. Aswe Godalo, Chairman, and Ms. Justina Alewa, Company Secretary, all of Sterling Bank PLC at the 57th Annual General Meeting of the bank in Lagos yesterday. I also have World Bank predicts $66 oil price in 2019. You can find this on page 19. And finally, doctor's brain drain. My comment misinterpreted in Gige. I remember what he said in an interview that doctors can leave, that we have
enough.
Wow. To see the new interpretation. And then finally, for sports news, Ronaldo wants Guardiola at Juve. Why? And that's what I have on Vanguard. What do you have on the Tribune this morning?
Okay, with me I have the Nigerian Tribune for Friday, 26 April 2019. And our lead story here says, Senate summons IGP over growing insecurity. You can find that story on page 3 of your Nigerian Tribune. Buhari leaves for UK on private visits to return May 2nd. You can find that story on page 4 of your Nigerian Tribune. And Yahoo Boy goes to jail for $35,000 fraud. You can find that story on page 29 of your Nigerian Tribune. And on sports for today, we have AFCON NFF discusses friendly with Burkina Faso and Benin Republic. And that's it for the Nigerian Tribune for April 26th, 2019.
Thank you so much. And Neki, Nigerian Observer.
All right, coming home to Edo States for the Nigerian Observer. On the top stories, EDSG will not sack workers, Shaibu says. It says government will pay 30,000 naira minimum wage. You can see the story on page 2. And also for our picture story, we have Edo State acting governor, retired Honorable Comrade Philip Shaibu's second right, joined other governors to receive President Muhammadu Buhari, who was on a one-day working visit to Lagos State recently. All right, Edo government intensify cleanup in Benin metropolis. You can find that story also on page 2. And Edo HIP was sustained campaign against malaria, Shaibu says. All right, going on to economy, we have 30 years FGN bond oversubscribed at April auction. And that is all we have for the Nigerian Tribune for April 26, 2019.
Thank you. Moving on to the Mr. and Mrs. segment
Always.
of the Bangladesh newspaper. So, Mrs. says, I prepared a special meal with cow leg, assorted meat, fried fish, fresh fish, and fresh vegetables. And Mr. says, whenever you prepare special meals, special request follows. Before I go ahead, remember, I'm just a salary earner. Alright, as we always have every Friday, we have our healthy living. And today on the show, we're being joined by a pediatrician. We're discussing child health. Stick around. My name is Joyce Chooks. This is The Breakfast Show and TSL Nigeria TV. Good morning.
Welcome back. A healthy child's development actually begins from conception through the prenatal period. The field of pediatric recognizes classical stages in growth and development. This is why medical doctors who specialize in this field can understand the different ranges of children's health care. The World Health Organization recommends a continuum care from inception through early formative years to safeguard and maximize the child's development outcome. Joining us on the breakfast show and sitting on the couch with my ladies and I is a doctor, a pediatric dentist. She'll be doing dual functionality this morning. This morning we get to you Dr. Osarugwe Enagege. She's a member of the Nigerian Dental Association, also a member of the Medical Women Association, and a prolific member of the Nigerian Dental Association.
I stand a queen.
Thank you. Thank you very
it's good to have you,
Thank
on
you.
Healthy
I'm
Living.
honored to be on your program. Anything to do with child health and child oral health is our concern, and any opportunity to enlighten the public about child oral health and care of the oral tissues is just wonderful. So I'm actually so pleased and so honored to be on your show. Thank you very much.
It was when I was doing my research that I found out that there was a pediatric dentist.
Oh, yes.
I didn't know
a different
that.
kind of dentist for children.
Yes.
Why do we need a different kind of dentist for children?
Well, children are how let's say they're different. They are different in terms of their size.
Okay.
You know, the kind of treatment you do for an adult is not the same you do for children, and particularly behavioral management in children. You see, some of the procedures you want to do as a dentist in a child, you know, you can't go ahead with it without controlling their behavior. An adult, you tell, I want to do this, I want to do that, and the child, then they cooperate with you. But children already have this anxiety, this fear that you have to deal with, you know, because children are a product of there's an interplay in a child's life: the community, the society, the school, the parents.
As they say, it takes a community to raise a child.
Yes. So you don't just you can't just tell a child, oh, I want to treat your teeth, and he just opens his mouth. You have to be trained in how to approach children, how to make children be your friend. In fact, pediatric dentists are different. We are like you have to learn about child psychology.
Wow.
You
I was going to
have to learn about child psychology, and even our apparels, what we put on, you know, the way the design of a pediatric dental clinic, yes,
it's colorful.
Different. Yes. You have to do things that will make them accept treatment. Yeah. And another thing is with children, whatever you do for them at this formative stage is what takes them throughout their lives. Whatever it is you do, if you do something destructive, painful, you know, it lives with them throughout their life. And that's what a lot of adults are already dealing with. You know, in the adult clinic, and they tell you, oh, when I was a child, I went through this, and I don't want my children to go through that. Do you understand? So we try to build and instill some kind of oral health care in them, so that they grasp it, they grow with it, and you know, when they are adults, they can also not only imbibe it, but also teach their children as well.
Amazing.
Yeah.
Before we go further, please, you can also drop your comments and follow this conversation on Facebook, TSL Nigeria TV. We're waiting for all of your lovely comments, and we're going to take all of them. Okay, ladies.
Thank you.
Go ahead. Pertaining to what you said about anxiety in children,
now
my question is, what really causes anxiety in kids?
Like
the Center for Disease Control estimated that 1 in 59 kids is affected with autism spectrum disorder. So I want to know, why do kids have anxiety and other mental disorder like depression? Like, what would cause a child to be depressed?
Thank you very much for that question. That's a beautiful question. As I said in my introduction, I said children are a product of their environment and the society and all that. And in terms of fear is like or anxiety is, you know, the child is something unknown. You know, something it's like a fear of the unknown. You know, that's like an anxiety. You are just anxious, but you can't specifically pinpoint something that, you know, you are anxious about or you are afraid about. And that is also because some of these children have been exposed to comments from their community, depending on if it's dental complaint. If someone has told you, oh, it's painful, a younger child wants to tease an older child wants to tease a younger child and says, oh, if you go to the dentist, you are going to be crying, so when that time comes to face that kind of challenge, the child is already scared. Then for autism that you mentioned, autism is a developmental disorder. You know, it's a psychological mental disorder, and they just come up. You know, it's not like it is caused by something particularly. You just have some children who have that spectrum of disorders, and once they are identified, you know, and you help such a child psychologically to go through that those disorders and the spectrum, they outgrow it. And
so how do you help a child overcome that disorder?
The first thing is identifying what autism it is, and that this child has this particular issue where he's not exactly, so is a social handicap, kind of. You know, it's not as the child is not like other children that are well adjusted to the normal societal living, you know, and so you have to help that child to deal with such issues. For example, if we have autistic children in the clinic, for example, they may like a particular doctor who saw them first, and when they come the next time,
and they don't want
to see. Yes, they just start throwing tantrums. You understand? You see this child, probably the parents tell you over at home, the child is very noisy, you tell him to do this, he doesn't want to do that, he doesn't want to sit in one place, he's always up and doing, yes. And then at other times they are just quiet, you know, they want to be on their own, and you can't really get through to them, you know. And then you see a lot of people having to traumatize such children, you know, in our society, beating them because they are not like others. But once those, some have speech delay. You know, it comes in a spectrum of, or a plethora of different, it comes out in different presentations. Some may have a delay in speech, in some developmental milestones, which you, with counseling, you know, the mother, the parents have to be counseled on this. The child would do
so
well.
So can say that this autism is the leading cause of inferiority complex in kids, like when they grow up?
No, not really. You see, there's when you talk of inferiority complex, you know, there must be something. You know, we've said in whatever a child manifests is a product of this community, the society. You don't know where this child what type of upbringing he has. But some children, even peer pressure, you know, make some children to not be confident. When you say inferiority complex, that means you mean the person is not confident of himself. There are so many reasons why a child will not be confident in himself.
My question is, as a pediatric dentist, and you've described the atmosphere you doctors get to set for children, what has been your worst case scenario?
Well, as a pediatric dentist, what we do is we are delivering oral health care to children. Okay. And oral health is a state where one one is free from dental pain. You're free from all sorts of diseases like periodontitis, tooth loss, and in such a way that you can eat, you can talk well, you can smile, you can swallow, and have good psychological well-being. That's how WHO, World Health Organization, describes oral health. Now, that's what we deliver to children. And what we have discovered is that there's a high rate of dental caries, especially in children. And that's because we have changed from our normal diet to a westernized diet. And this change is global. It's not just Nigeria or not just Africa, but in more developed countries, it's matched with better health care, better access to health care facilities. For example, in the developed countries have discovered this problem, especially in children, and they have discovered and they've decided to go about in doing some kind of things like water fluoridation. You see, in the central water supply for most developed countries has fluoride. Right?
Wow.
Many children are on a health insurance scheme with their families. Okay. So when such issues crop up, you see that they can be managed. It's not that they don't. It's not that the children of children in other countries are exposed to westernized diet. I mean, that's what the type of diet we're talking about. But they have access to health care. In Africa, in Nigeria particularly, various studies have shown that we are having an increasing prevalence of dental caries, especially in children. And what does this cause? So many studies have shown that these children have pain, which is the first one. They eventually have tooth loss. They can't speak well. Their parents spend a lot of money, out of pocket spending. They have to miss school. They have to miss school a number of times. And, you know, the access to healthcare, many of them do not seek dental care early, and then there's a lot of complications. It's not just having a hole in a tooth, because that's the common term for dental caries, but this infection spreads, and we have seen cases where we have abscesses that spread to the brain and children die. Children are hospitalized. There are massive swelling, cellulitis. So all these are challenges, but our aim also is to teach the public, especially mothers, right, that right from the time a child's tooth erupts, children's teeth, you know, give or take 6 months, 4 to 6 months, that's when the first tooth usually erupts. Okay. You should see a dentist within 6 months of your child's first tooth eruption. Not only that, you should start cleaning your child's teeth. We are amazed. So many mothers say they are afraid to clean their children's teeth. And World Health Organization has talked about breastfeeding. We know that breastfeeding is the optimum for a child in the first few months of life. That's where the child gets all, the nutrients, yes, in a healthy, but most mothers breastfeed their babies and do not clean their babies' mouth and teeth, you know. And then you know that the World Health Organization also says you can breastfeed till 2 years, but even when you are breastfeeding till 2 years of age, because you see some children, they're already walking, their mothers are breastfeeding them. Okay. We say it's good, but it must be coupled with good hygiene practices. By 2 years, these children already almost have a full complement of teeth. And even the World Health Organization says breastfeeding alone is not sufficient for those children. They need to couple it with our regular diet. From 6 months, children should be introduced to our regular diet. And so they need to clean their teeth. Also, we know that it's not, some mothers cannot breastfeed and introduce their babies to bottle feeding. Now, bottle feeding is also, if not well managed, like it has been seen to be a major cause of these dental caries in children. Most mothers want to sleep at night, so they put the bottle in the mouth. so that the baby sleeps with it. Now, at night, there's reduced salivary flow for everybody. Right. And saliva, it's a good thing. Saliva is a good thing. It helps in oral clearance. So when there's reduced salivary flow with increased insult of choriogenic substances, sugary substances in the bottle feeding, before you know it, bacteria, which is a normal commensal in the saliva, starts being active, right? And then as it's acting on the choriogenic substance, it releases acids, and these acids start breaking down the teeth. And you find out that we have so many children with coming up with what we call early childhood caries. Early childhood caries is the presence of decayed, missing, or failed teeth in a child 71 months old or younger. So that means less than 6 years. And then we are now beginning to see children coming to the hospital with all their teeth broken down. Now, this is a challenge. These children, when we see them, the first thing is we have to counsel the parents, because you can't just tell this child, oh, your tooth is broken down. Open your mouth and let me treat it. They won't let you do that. No child will open his mouth and you see all those materials coming into the mouth. And most of the time, you have to give this child an anesthetic, to numb that area so that you can walk. These children will not cooperate with you. Sometimes it's so bad you have to sedate these children in order to treat their teeth. Now we try to counsel parents that all this is preventable. In as much as we have a lot of children have changed to a westernized diet in all over the world, this is preventable, with adequate cleaning of your child's teeth, adequate monitoring. The International Association for Pediatric Dentistry says that a child less than 7 years should not brush unaided. Very interesting, because we see so many parents coming to the clinic, like we tactically ask. That's how we extract this information. We don't just, because when people know what you want to ask, they try to look for a good answer. And so we tactfully ask, who cleans your child's teeth? Oh, he's a big boy. You see children 4 years, 3 years, they clean their teeth themselves. I mean, we know that children do not have that manual dexterity to clean their teeth properly. They have to be supervised. And they suck the paste. Yes. Or they chew the toothbrush and all that. And so another thing is regular dental visits. Like in any hospital, you are not charged to come and just for a checkup. Every child should go for a checkup as early as 6 months.
So before we continue, let's go to our Facebook page. Dominion Okeke says, good morning, ladies. Nice outfits. And he said to the doctor, I love the fact that you talked about health care of children. But how do we trust the doctors who help to solve such health issues? Because I believe some parents ignore the help of doctors due to lack of trust, maybe from the experience of the harm the doctor has caused.
Well, that is true. Very true, because a lot of our people, because of our cultural practices, actually our hospital, our clinics are the last port of care. They have gone through all others. They have gone to neighbors. They've asked neighbors, what should we do about this issue? And neighbors have given them advice before they come to us. So that's why this type of program is very apt. And that's why we like to go out to campaign to schools, to markets, to give awareness, sensitization. And we also, on our own, have to train ourselves too, because it's our action that the public is responding to. If we, as a body, as a professional body, we train ourselves on how to, have our own PR, have our own PR, so that so that when the patients come, they tell their neighbors, I went there and it's not the way people described it, So we also, as a medical society, we also have to have our own reorientation. But actually, that may also be, I'm not exonerating ourselves, but also because we have a very low doctor-patient ratio. Low nurse-patient ratio. So sometimes the system is over.
It's choked up.
Yes, it's choked up, and then because of that, you cannot give the individual care that you actually ought to give. But that is not excusing us. But as I said to that lady, we need a reorientation of ourselves. But I will also use this program to appeal to her, to appeal to all others who are listening, that the hospital is well structured to receive patients, and the care of a child or of an ill person supersedes any other feeling that you may have about going to that place. The aim of going to a hospital is to get optimum health care, and you will get it at the University of Benin Teaching Hospital and all other teaching hospitals or hospitals.
I wanted to ask, you've been speaking about oral care in children and stuff, and we all know that the oral care of a child should start when they start teething or when you start breastfeeding and stuff. What are some pointers that parents that are watching could have behind their head for when their children start teething? Because children are very hectic once they start teething. Yeah, the truth is that there's this myth in teething that at about 6 months of age, if you tell your neighbor that your child is stooling and having some fever and thereabout, they spread the news that, oh, maybe she's teething, because that's usually associated with that period. The truth is that that's not true. That's not really true. What happens is that when a child is born, he carries the immunity of the mother, which is passive immunity, which usually tails off at about 6 months of age. It's at about 6 months of age that a child tails off from his mother's immunity, right, and then starts developing his own immunity. So at about that time, it just so happens that this child, some parents too, it is also around this time you see children, as part of their developmental milestones, they are picking things from the ground, putting in the mouth, trying to feel, they're trying to feel the environment. Yes, they're curious, they're moving about, and then they're putting things in their mouth and all that. And so it just coincides with that period that a child is teething. So if there's any sign of malaria or fever or stooling in a child, it's an emergency. Don't call it teething. That child should go to the hospital to be checked immediately, because it's stooling and fever, just as you are looking at it, has led to the death of the mortality rate has increased because of this. So, and that's because people ignore it and say, oh, it's teething. Yes. Teething on its own, of course, as the teeth is cutting through the oral or the gum, right? There are lots of, there's an inflammation that comes around it, and there are local therapies that we encourage mothers to do. While they are doing that, some of these children are salivating. They are looking for things to use to ease themselves because of that. They kind of they have this uncomfortable feeling. And then we tell them there are things we advise parents to get. They can go to the shops and get something that the child that can use to be cleaning on that place. But generally we recommend that you should keep your house and your environment clean. The child should be, if you are using bottles or whatever to feed the baby, it should be kept clean. The surrounding of the child, around that time that child is teething, the surrounding, your environment should be kept clean to prevent this child from gaining any infection. But if peradventure this child develops a fever or stooling, at that time the child should go and see a pediatrician.
Wow, that's been so much to take in. My question, as we begin to wrap up, comes to immunization. Now, I know that there's some part of the country where immunization, while a mother is pregnant, it's being looked down on. They don't really talk about immunization. Does it in any way help the child's oral health when they're born?
Oh, yes. Yes. As part of history taking, when we are dealing with children, because we see children as a pediatric dentist from birth to 16 or 17 years. So we see the very young, we see infants, we see the school age children, we see the middle school children, we see the teenagers and young adults. Now, when we are taking history, we have to make sure that these children have been well immunized. You see, oral health has links to general health. It has been a subject of recent research and discourse, because the oral cavity, your mouth, is the key to, is the gateway to your body, right? And then A lot of symptoms of systemic diseases are seen in the mouth, are seen first in the mouth. And also the oral manifestation, the oral manifestation of so many diseases like HIV, you see the dentist may be the person to see such manifestation first, because you came for something else, and on looking into the mouth you see signs of this patient having other systemic diseases like diabetes, like leukemia, like HIV, and all the works. Now in children, your question particularly is, does the immunization status affect oral health? Yes. If a child is well immunized, that means this child defense system, you know, has been boosted up, right? And so this child is free and likely to be resistant to some of these diseases that are common around.
At what age is it advisable for a child to be immunized?
Oh, they are different. There's a national immunization schedule.
Okay.
And it kind of, that's for us. The immunization schedule varies from country to country.
Okay.
But in Nigeria, we know that at birth, there's the BCG that you are giving to the child, in addition to your oral, you know, the polio virus is also rampant. At 6 weeks, you also get some boosts. You have some immunization. At 14 weeks, we have some more. At, you know, just like that, up till 5 years of age, you still keep giving polio vaccine, because especially in the north, as you said, it's rampant. Now, what you particularly mentioned was, you said something about people not accepting immunization. Yes, and it's also because of this cultural belief. We are very cultural people, and we listen more to the word of mouth than what you hear from the TV or from the social media. We listen to what our people tell us. And most people have initially said these vaccines were not safe. The vaccines that are supposed to be to boost our children's health and prevent them from diseases, people were going about, you know, saying that they were not safe and that they could cause all sorts of things in people. Like the polio vaccine, which is supposed to make children not go through that crippling disease that is associated with poliomyelitis. They were told that if they take that vaccine, they would come down with it. So the mother decided to keep their children. When they see the immunization officers, they run away from them. They prevent them from coming in. Especially in the north, where you have women in Poda, women who are in who you don't have access to. It's not like in our south where you can just go to the markets and just approach any woman and say, oh, bring your child, let me immunize them. These children are kept in the homes, and the healthcare workers cannot have access to them except they come out. So if they have been told not to bring their children out, then they wouldn't. So such little cases still exist, and you still see the ministry and the government going on revisiting the immunization, going about it over and over and over again to try and reach as many children as possible.
Okay, but is it possible for the vaccine that is supposed to prevent a particular disease to cause it?
No, because before a vaccine is released to the public, it has gone through a lot of trials, clinical trials and testing. Of course, it doesn't mean that there's nothing that is 100%, but I can assure you that before any vaccine is administered to humans, the rate of it causing any harm is very, very, very minimal. And once such harm or such an occurrence occurs, it is taken very seriously. We have the Center for Disease Control, we have the World Health Organization, so they go through all means to either test it, check the complaints, and withdraw such vaccine. They will not continue on a campaign for more people to get immunized if there's a problem.
I'm going to have to wrap it up right now. We've had such a wonderful conversation. I want to go on and on and on and on.
I tell you, Joyce.
Thank you.
I'm so full. Thank you
Whenever
so
we have
much.
doctors on here, I learn way too much, and then I'm terrified for my life. And we're going to call it a day. I don't know if I should ask you this one question. Maybe I shouldn't. But there is a new malaria vaccine that's supposed to be tested on African children. Have you heard about it?
In Malawi,
Yes,
Kenya,
yes,
it was in the
yes.
news 2 days ago.
Yes, I have, and I'm sure for those who are in CDC, that Center for Disease Control, they will make efforts. You know, if you know, with we also have most of these vaccines are donations.
Okay.
We don't
make them.
We do not only that we don't make them. We don't spend so much money. You know, on it's like you hear the government saying their budget is tight. Their budget is tight. So most of these vaccines that come in, they are donations from Ford Foundation and all those other different agencies. So our prayer is that it would also come here.
Our prayer is that it comes this way, amen, because malaria is a serious issue. As a person that suffers from it so much, I don't mind going and join the children.
We just had World Malaria Day yesterday.
Yes. Thank you so much, Dr. Nagege, for joining us as well.
I hope you will give me this opportunity to come and talk about other issues concerning oral health.
We would love
to, definitely.
And of course, thank you to Neki. You look amazing. Thank you so much. Thank you so much. You look fire. Thank you so much, Doctor.
Thank you very much.
And of course, thank you for tuning in and watching and viewing every time. Remember that we're growing our YouTube family. We'd love for you to join us. Just go on YouTube, TS100 TV, and hit subscribe. We'll be here again tomorrow by 10 a.m. this time. We're on for the weekend rundown, where we give you the craziest stories of everything that happened in the past week. My name is Joyce Jukes. This has been The Breakfast Show on TS100 TV. Good morning. Happy weekend.
Good morning.
Good morning.